the fall, how it ends. It's the fall, how it ends. Or it's the fall, how we rise again. Ooh.
Good afternoon, all. This is Dr. Prachita Dugad, Masters in Cardiorespiratory Physiotherapy, final year student. So, welcome to another PhysioTV session. So, today's topic is direct body composition and its direct and indirect. So, today's topic is body composition. We'll see what are the direct and indirect measures of body composition. So, moving forward to it. What are the objectives? At the end, you will be able to know you'll be able to know what is body composition and what are the direct and indirect measures or assessment of body composition. So what is body composition? It is used to describe the percentage of fats, water, bone mineral, and protein content in a human body. And the techniques to determine body composition is consist of two-component model. Earlier it was two-component model. Now it has been modified to three-component model. So in compartment one, the first compartment model consists of the whole body, in which is then modified to second compartment model. Then the whole body is divided into fat free mass, that is lean body mass, and fat mass, which consists of storage fat and essential fat. Storage fats are the fats that fat stored in the fat cells of the adipose tissues, and the fat surrounding the internal organs, whereas the essential fat is the amount of fat that is necessary for normal bodily functions, which is found in bone marrow, CNS, within the organ tissue themselves. So this helps us to understand that there is a certain amount of fat in the body that is not just an excess fat. Okay, through weight loss or through exercise training programs, this will not help us to reduce the essential fats which is present in our body. Unless there is a serious complications, it will not reduce. So then the second compartment model got modified into third compartment model, in which the fat-free mass is differentiated into bone mineral content and lean body mass, and fat mass is visceral and subcutaneous adipose tissue. So this in third compartment model, the distinguishing factor is that the bone mineral content and fat free mass. So modern technology has allowed, like DEXA scan has allowed us to differentiate body mineral content from soft tissue composition. Okay, so this measurement or this allows for simultaneous determination of fat mass, fat free mass, and bone mineral content. So what is the benefit of third compartment model? It gives a greater insight into patients or subjects nutritional status that can be seen in third compartment model and not in first and second. So methods for the assessment of body composition, there are direct method and indirect methods. So direct method by chemical analysis of animal carcass or human cadaver. The cadaver must be dissected completely and each tissue would be analyzed for fat, protein and mineral content. While the indirect methods would be measures of circumference, body mass index, hydrostatic weighing, air displacement plethysmography, bioelectrical impedance analysis, magnetic resonance imaging, computed tomography, and DEXA scan. So measures of circumference using a measuring tape. So there are different measures for abdomen, hips, thigh, upper arm, forearm, and calf. So according to WHO, they have given the normative values for all. So for abdomen, it is 2.5 above the umbilicus, it is measured. For hip, the maximum protrusion when the patient or the subject is standing with feet together or heels together, the maximum point of protrusion is then measured. For thigh, upper thigh just below the buttocks. For upper arm, between the shoulder and elbow. For forearm, forearm arm extended in front of the body, palm up, and measure the maximum girth wala area. Then for calf, measure the maximum girth midway between ankle and the knee. So according to WHO, they have given the normative values for all. Now coming to waist hip ratio, this is the table risk criteria for waist circumference in women and men. So very low, low, high, very high. This table gives us a normative data or normative value or distinguishing the high risk criteria for waist hip ratio more than 0.95 for young men, and for young women whose waist hip ratio is exceeds more than 0.86 are at high risk. So this is the irrigation equation. So what all the measurement we have taken, girth measurement we have taken, will split up the value or will substitute the values and will get the body density for men as well as for women. Now coming to body mass index. Also for measures of circumference, the reliability is 0.94. Now coming to body mass index. So it is weight upon height square. So its reliability is 0.6 and it is used to assess weight relative to height and is calculated by weight upon height square. So there has been given WHO classification for weight status and there is WHO Asian BMI classification. So according to that, we'll categorize the subject into underweight, normal range, overweight or obese. Now, hydrostatic weighing. So it depends upon Archimedes principle. So it is like it is the difference between the body mass measured in air and the body weight measured during the water summation. So what is Archimedes principle? It is the density of the body is equal to the mass of the body divided by its volume. So this is the formula. Like for this, in this, we also have to measure the mass air and mass water. Okay. So, so density of the body equal to mass air divided by mass air, mass water divided by density of water with minus RV, that is residual air and residual volume plus the air which is present in gastrointestinal tract. So that has been subtracted. Will give the density of the water. So it can only be done on the set locations, takes 30 minutes and widely accepted and gold standard. But the only drawback is it can be done only on the set locations. So popular equations for determining percent body fat from body density. Again, there is two formula, Brozek and Seri, for percent body fat. So by substituting those values, we'll get this. Now, air displacement plethysmography, its reliability is 0.96. So it is also called as BOD-POD. The system is called as BOD-POD. So it is a dual chambered plethysmograph that provides densitometric means of body composition. It is like this. So it measure BOD-POD determines body volume by measuring the initial volume of empty chamber. First, it will measure the volume of empty chamber and then the volume with the person inside. So again, the formula is body density is equal to body mass, which is measured in air divided by body volume. So it also takes 10 to 15 minutes. Only can be done on set locations. Now, skin fold thickness. So its reliability is 0.90. The only it is performed using a caliper, a pincer type caliper, accurately measured subcutaneous fat at selected anatomical sites. So for abdominal, it is vertical fold 2 centimeters side of the umbilicus. For triceps, again a vertical fold midline between the upper arm and halfway between the acromion and olecranon. For subscapular, a diagonal fold below the inferior angle of scapula. For chest, diagonal fold. For men, it is 1/2 distance between the anterior axillary line and the nipple, and for women, it is 1/3 distance. Mid-axillary, a vertical fold, mid-axillary line at the level of xiphoid process of sternum. Suprailium, a diagonal fold along the natural angle of iliac crest, taken superiorly to the iliac crest in anterior axillary line. For thigh, a vertical fold midway between top of the patella and inguinal crease on the anterior midline of the thigh. So again in this pictures, it is given for abdomen. How it is given for abdomen? Vertical fold, diagonal fold. Then for abdomen in B, chest, subscapula, suprailium, triceps, mid-axillary, and so again, these are the measurements, 3-side formula and 7-side formula for men and women. So by substituting those values, we'll get the body density. Now, bioelectrical impedance analysis. So it is easy to administer. It is non-invasive and safe method. It is a small portable instrument. It is used to pass an electric current. So resistance of that electric current is then measured. Resistance to current flow is inversely related to the lean mass and total body water, as lean tissue mass and water are the good conductor of electricity, but fat is not. So fat mass, fat-free mass, and total body water are calculated by bioelectrical impedance analysis. So it is like this. Then MRI. So it present an image of various body tissues. So electromagnetic waves are getting transmitted through that tissues. So the hydrogen nuclei of body's water and the fat molecules absorb and then they release energy. So that resonant frequency properties can be arranged by the computer, and through that we can get the detailed images of the body tissues. So, and then that through that we can get the volumes of specific tissues, and then we can then that can be quantified also. Computed tomography, again, it provides information about fat and lean tissue content and thickness of various organs, but it is mainly for diagnostic purposes and not for body composition analysis. Also, now, dual energy X-ray absorption metric DEXA scan, that is mostly used for for assessing bone mineral content, bone density. DEXA allows us the quantification of not only bone but also fat and muscle around the bony areas of the body. Determines total body levels of lean, fat, and bone mass. It requires 6 minutes. That's for right arm, trunk, left leg, and right leg. So this has been divided into fat, lean, and bone. Thank you. I hope this information will be valuable for all of you. Thank you.